Hi, I'm Matthew McNutt, orthodontist. Invisalign is an alternative to braces and is a great treatment option for adult professionals and teens with active and athletic lifestyles. Before I explain how teeth are moved with Invisalign, I want to address some issues that can be confusing for patients. The technology behind Invisalign improves every year, and the quality of treatment outcomes is greatly dependent upon the skill and knowledge of the doctor. Because Invisalign allows the doctor to create a custom treatment plan for each individual patient through a complicated software system, the effectiveness of Invisalign varies from doctor to doctor. In fact, unless an orthodontist has invested great time and effort into learning the Invisalign system, you will find that they will not even offer Invisalign as an option to their patients. People are also aware that some general dentists provide Invisalign for their patients. The difference between a general dentist and an orthodontist can be confusing. Orthodontists are specially trained after becoming dentists, in my case for 3 additional years at UNC Chapel Hill. The advanced training that I have as an orthodontist allows me to apply my expertise as a specialist to the Invisalign system in order to maximize results for my patients. This is important to know because patients are sometimes confused as to why the cost of Invisalign may vary from doctor to doctor, and patients are confused sometimes as to why the number of aligners to be worn to move the teeth may vary greatly from doctor to doctor. The best way to think about this is that you're not buying a product off the shelf. You are investing in an outcome, which in this case is a beautiful smile and a healthy bite. Now let's discuss how Invisalign works. With Invisalign, teeth are carefully moved in small steps over time by wearing a series of removable clear aligners. These aligners are made of smooth, comfortable, and virtually invisible plastic that you simply wear over your teeth. Wearing the aligners will gradually and gently shift your teeth into place. Aligners are generally worn for 18 to 22 hours per day, and you simply slip a new set of aligners over your teeth approximately every 2 weeks. With each successive set of aligners, you get closer and closer to the smile that you've always wanted. Many of my patients have told me that most people don't even notice that they are wearing their aligners and that they're straightening their teeth. Like braces, Invisalign aligners are removable. That means you have the flexibility to remove your aligners to eat and drink what you want during treatment. There are no metal brackets or wires that could cause irritation to your mouth. Appointments with my Invisalign patients are also generally shorter, and repairs are less common when you compare it to patients with braces. Another attractive reason to consider Invisalign is that patients are able to brush and floss as normal. One of the biggest challenges of having braces is removing all the food that gets trapped in the brackets and the wires. For teens who may have difficulty maintaining good oral hygiene with braces, which is considerably more difficult, Invisalign Teen may be the preferred treatment option. So who is a good candidate for Invisalign, and is it as effective as braces? At the new patient consultation, I carefully evaluate each patient, and I'll advise which treatment options are best. Not every patient is a good fit for Invisalign, and sometimes braces will have a definite clinical advantage. However, there are certain clinical situations where I clearly prefer Invisalign over braces. Patients often ask me, is Invisalign as effective as braces? Each patient is unique, and I approach it this way. When Invisalign is equally as effective, I will leave it up to the patient to decide. When braces have a definite advantage, I may let the patient know that Invisalign is not an option. When Invisalign has a definite advantage over braces, I'll advise the patient that I prefer Invisalign. Thank you for listening, and I hope this talk leaves you well informed about Invisalign.